I don't know.
You're best served. You're best served now. With the situation of things in Nigeria, you're best served as much as possible. Taking your health, your fitness very, very
seriously.
Yeah.
Do what you can. At least, so I say rule of thumb, every day try to get your heart beating faster.
Yeah, true.
Just get it. Do some cardio, do something, maybe a run or walk or something that will
climb some stairs.
Yes, climb some stairs. Don't always use the lift. Don't always sit down if you are in an office space and you have to sit down all the while you are. Move around because our doctors are leaving.
And we also think, before we delve into that, just quickly need to note that we also have apps and phones now that actually record your number of steps for every step each day, which would also help, that heart beating fat and also help, your fitness routine altogether. So I think you should...
so I had this watch on for the past 2 weeks. I took it off today because I was like, I'm putting myself under too much pressure. Because it tells me I need to have 10,000 steps every day. And then at the end of the day, I look at it and I'm like, 5,000. I'm like, whoa!
Leave it on. Because, you see, I was going through some stuff after seeing the shameful, that's how I would describe it, shameful for our country, not of course for the people who went there to try to better their lives, the doctors who went there, but at the moment, NARD, the Association of Resident Doctors are on strike.
Yes.
And then
the federal government has refused to meet their demands.
And then if a foreign country via an agency is doing recruitment exercise right in our capital, like, how does that work?
And there are still going to be more recruitment exercises in the next couple of weeks.
So imagine in different parts of the country. And then they just come into here and they're doing recruitment exercise, and I'm paying 10K. Like, you have over 500 doctors in Abuja, they'll have in Lagos and all of that to go to the UAE.
Yeah.
I found out something. As at the last time, February, because we don't do very well when it comes to keeping numbers and being accountable, we don't do very well in this country. But at the minimum, we have one doctor to 5,000 people.
Patients.
5,000 people in this country.
That's scary.
By a WHO standards, it's supposed to be at the minimum one doctor to 600.
Yeah.
You understand? Now you go to Dubai, to the UAE. The UAE has 2.57 to 1,000. That means that to 5,000, that will be by 5. The UAE has over 12 doctors to 5,000.
To 5,000 people.
So that means that they have, on average, 12 doctors more than a doctor in Nigeria. 12 more per population.
Yeah.
I don't know if you get what
And they're still recruiting more.
And then they come to recruit more. And then we know that we're even managing the ones that we have. Like, how does this not send alarm signals? How is a state of emergency not called?
Being declared,
How
when you think about the reason for the strike as well, that's a challenge. So most countries all around the world have been upping their game in terms of the medical
health center, their health system
everywhere.
So
upping their security, upping the way they look after their doctors. In fact, doctors are like kings and queens.
That's the thing. How are our politicians paid so much? The allowances, when you hear somebody, the newspaper allowance is more than the salary of 3 or 4 doctors. And that's what someone is collecting for newspaper.
It's really...
You understand? And then how do you expect a doctor to feel? My point is, of course, we have our foreign officials. They go, medical tourism, Nigeria is the #1 when it comes to medical tourism. To India, to the UK, to the US, and all of that.
There's a problem, and the quicker we try and find a solution to that problem, the better.
It's really sad because brain drain has been an issue. It has been an impending issue. It didn't just start today.
But this one is bad.
Since the 80s.
They will say inside our own capital, they are doing their recruitment. Inside the open university.
I understand. But on the other hand, do you blame these doctors for seeking greener pastures?
No, of course not.
There's absolutely nothing wrong with that.
Because they spent how many years in medical school?
Like you said, it's a call for concern. If our leaders get a cue from this, they should know to step up. Our healthcare system needs help. It needs work. You're also talking about insecurity issues. You're talking about lack of manpower. They're talking about, even some of the doctors complained of even having to pay some of the patients' health bills. You know, it's the crippling economy is one of the major cause for this brain drain. The earlier it is being addressed, the better.
If I want to start, if we wanted to go into this, we won't have time. We have to. There's so much. But you see, but this one. I'm not trying to patronize Nigerians. We have some of the most intelligent doctors in the world.
Very true.
And who have gone out and they are thriving and they are succeeding and they're becoming heads at what they do.
Would take out a baby, operate on the baby, put the baby back, and the baby will go. What is not a miracle in that thing? See, if I continue, let's just take this break.
We would love to have your comments and contributions on this. Just use our hashtag WakeUpNigeria on TVC as you do.